because many of my seniors, through word of mouth, they said, reads, take speed assess and do all the questions, it will be enough. Which I read through the speed, it through questions, and the explanation had the photographs of the books only, not like the written type. The photographs, the tables, and the options were clearly defined.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr. Vaibhav Kuraria for scoring a topmost rank of 48 in MCS surgical group in NEET SS session 2025. Congratulations to you, Doctor.
Thank you, sir.
Great. Now, I thank you for the valuable time that you are sparing with us to share your experiences with us and also to all our students.
Yes, sir.
Great. Now, can we know a brief background from where you started till date, what all you have done?
Yes, sir. Sir, I am born and brought up in Delhi. I've done my MBBS from Maulana Azad Medical College and my MS from Safdarjung Hospital, Padman Mahabir Medical College. And yes, sir.
Great.
Uh,
Topmost medical colleges you have been trained and been amazingly doing well. Great, amazing, very good. What is your super specialty interest?
sir, neurosurgery. I've also given INISS examination of November. My branch of choice is neurosurgery, sir. No other choice.
Great. So, I mean, what happened to INASS?
Sir, rank 20, AML rank 20. Yes, sir. I have been allotted AIMS Jodhpur in that.
So,
But
what happened?
now, now, sir, I'm moving towards my hometown only, sir. I'll be picking most likely if everything went right at GB Pant Hospital, sir.
Very good, excellent. So, can you tell us why neurosurgery?
Sir, I think no one direct answer will be a direct one, but since like during my undergraduation and my residency, I've always like the branch the neurosurgery. Like, it's like the anatomical and physiological correlation is very good, and what we can achieve in neurosurgery residency and surgical procedures, I like that very much, sir. Plus the thrill it gives, uh, that always kicked me, sir.
Great, wonderful, wonderful. Doctor, can we know once you decided to do a neurosurgery as a super specialty, what all you did? What all you prepared, how you prepared, what is the preparation strategy to achieve topmost rank NESS and NEETSS?
Sir, as Safdarjung is very hands-on institute, sir. We hardly get any time, but during my third year, I have started reading some basic of neurosurgery. Then I have also like first is residency. I have basic is residency to focus on residency and patient care, and then theory books I have read, sir, like basics in Bailey that every senior which have taught me basics to read from Bailey and Love, and then Sebastian for GI and endocrine for shorts. That I have not skipped, sir, to first to get a command over the subject because and then sir I have focused to need speed assess because many of my seniors through word of mouth they said reads take speed assess and do all the questions, it will be enough. So and then I took a free trial and then I have seen some like extensive database of everything which I can scroll and scroll, it won't get over. So I have just completed my few topics from that and then I carried forward, sir.
Okay. You liked it?
Yes, sir. I got to know that what were my weak points in during my residency, which were CTVS and plastic surgery. So that which I read through the speed, it through questions, and the explanation had the photographs of the books only, not like the written type. The photographs, the tables, and the options were clearly defined. So I read the CTVS part and revised the CTVS part from the questions only. And every topic,
Okay.
I bookmarked that question which were wrong, and then later on I went back to them why they were wrong, and then repeated it again because the wrong questions were like sometimes the questions which I have attempted right, they might be right because I know it, or they might be a fluke. So I bookmarked them because they were a fluke. I reattempted them why it was wrong. I read the explanation and did it again.
Oh, great. Good to
Yes,
know.
sir.
Thanks for sharing. So, your number of questions attempted in the exam or about the paper, can you share something on that?
Yes, sir. So there are three sections, sir. In part A, I have left two questions. Part Overall, I have left only 5 questions, sir, because I was not sure if I was able, and the paper was like, sir, moderate paper, sir. Around 45 questions, they were NEET PG level only. It was like very basic, and if, around 50 to 60 odd questions were like basic clinical questions, sir. The CTBS part, which that was a tough part, sir, because maybe the preparation was not very right, or maybe the paper was tough. That task was very tough. But overall, the paper was moderate, and purely clinical questions were there, sir. Not very long, and the options were um, fewer confusing questions. I was able to rule out at least two options. If I was able to rule out two options, then wherever my gut says, I will mark that. Around 140, 135 questions, I knew that I was able to rule out. But 15 questions, I took a bit, and 5 questions I left because I was not very sure. Paper was, there was more of a images. As I was prepared for neurosurgery also, the paper on neurosurgery was a tougher if the students have not revised neurosurgery properly. It was a tougher section for neurosurgery also. Otherwise, it was a broad specialty and clinical oriented paper only, sir.
Great. Now, what will be your advice for the future aspirants of MCA surgical group?
Sir, first is to properly take care of residency part. Don't jump to any preparation for MCQs. Complete residency and patient care and take part in rounds, because I was lucky, because my seniors were very adamant during my OPD ward, and then after late night call, they have to discuss what happened. We have to read every topic like urology. My seniors were like, read from Bailey and then from Campbell, and they have to discuss what is the right, what is the wrong thing. I was very lucky in that. So take your residency very seriously. Second part is theory books that have to be read. Third part is revision, sir. Revision from MCQ. And then fourth is to understand the language of the questions. Because when we read, there is passive learning. We have to make sure that we have to understand the language of the MCQ, and then we have to revise MCQ again and again. That is the part, sir.
Great. Wonderful, doctor. And time to thank, and whom all you want to thank, you feel that they have helped you till date, and you
Yes,
can
sir.
the platform to do so.
Uh, Sir, my family, my mother, father, my sister, my wife, uh, sir, my seniors from my residency, my professors, sir, they were really good during my residency. They helped me a lot. All my batchmates, my two batchmates, without whom I was not able to complete my residency. And thank you, Speed, and all my professors, sir. Thank you.
I mean, it was wonderful that you share all that you felt and your experiences. It was very useful.
Thank you,
And
sir.
I wish you all the very best and all the success for a great career as a neurosurgeon in making, and you will definitely do great. Wish you all the best.
Thank you, sir. Thank you so much, sir.